Hello, everybody. My name is Dr. Corey Singer. I am a chiropractor and wellness professional here in Brea, California. I just want to give you guys a little bit about my story, my why behind becoming a chiropractor. And so, pretty much my journey started when I was just a young kid. I was always fascinated by putting my hands on people. I loved rubbing people and giving massages and things like that. And I remember one day in particular where my aunt had a really bad migraine headache, and she was laid up in bed, and wasn't feeling well. And so I went up to her. I was like 10 years old or something like that, and I ended up just kind of rubbing the back of her neck and like towards the base of her skull and things like that. And I remember, after I don't know how long it was, but I stopped giving her a massage, and she said, "Corey, my headache is gone." And I was like, "What?" That's amazing. I couldn't believe it. I was like, what? All I did was I just put my hands on you, and now your headache is gone. I thought that was just an incredible, amazing thing to do for somebody. And I thought to myself, the feeling I got was incredible. I was like, well, this question I was asking was like, how can I get that feeling and be able to help people for my whole life? Because I just love that feeling. And so I thought I was going to be a massage therapist. So I was massaging people and again learning more about massage therapy, reading books on it. And then one day I told my mom, I was like, "Hey, mom, I'm going to be a massage therapist." And she's like, "Oh, that would be great." But there's also this thing called chiropractic that she had told me about. And so I started looking into that, and I was like, "Wow, that sounds really fascinating and interesting." And I started learning about the philosophy of how the body can heal itself, how we don't necessarily need drugs or surgery to be able to heal ourselves, where healing really comes from within. And I thought that really resonated with my philosophy and just the way I saw things. And so I started going into this route of chiropractic even when I was like about in high school. Um, After that, I heard about another profession called osteopathic. And osteopathic seemed very interesting too because they were working in hospitals and working with doctors and things like that, working alongside medical doctors. And I thought, well, that would be kind of cool. I'd be able to use the learn about the osteopathic and learn about medicine to be able to help people get off of medication. So I thought that would be the reason I would want to use it. And at the same time, growing up, my mom had, going back into my mother's story, she had really, really bad health problems throughout my entire childhood, where she would go into, what's called hereditary angioedema and laryngospasm. So what that means is it's an autoimmune disorder where her throat will close up on her, and her skin will her histamine counts would get so high that her skin would literally burn from the inside out. And this would happen repeatedly throughout my childhood. And the question I was having was like, well, why can't her body heal? What's going on? And I wanted to find out, how can I help her? How can I make it so she doesn't have that pain, and she's able to heal herself? And so that was the driving question that I had throughout my whole life, was like, how does the body actually heal? How can you make the body work from the inside out? How could you get it to work? So that was the question I had throughout my whole life. Now, going back into the story about me going through, I went into pre-osteopathic, going into out over at Cal State Fullerton. I was studying and I was learning. And about that time, maybe sophomore year of college, my girlfriend at the time, who's now my wife, was involved in a really serious car accident. So to the point where she was T-boned from the side. Her she had to be air vac'd. There was a stent inside of the back of her head, where just to flush out the swelling. Massive surgery. She broke several bones. Fractured her pelvis and her lower back and multiple things. So we weren't even sure if she was going to survive, and she ended up pulling through. But the doctors that obviously saved her life with surgeries, medications, those things were amazing for that period. That was the extent of what they could offer her. she ended up, being, well, she was a dancer before that, and she, so they after she was done with her rehabilitation, she was on a walker, and they said, that's the best that we can do. Looks like you're going to be on this walker for the rest of your life. um, but at least you have that, right? And she wasn't happy with that, and she wanted to see if she can, what she can do about it. She ended up going to see a chiropractor. One of our friends had been to goes and sees like this chiropractor in La Habra, and she was like, all right, well, I don't think it's gonna work, but I'm gonna go try it out. And so I was watching this process, and she met this chiropractor, and he started working with her and started healing her body, and she was seeing him multiple times a day, and I thought it was just fascinating, and I watched the miracles that started taking place. Her body started to come back online, where she went from having the walker to just having a cane, and then from having the cane to without the cane, and so I was going with her to these appointments, and I thought it was amazing to see this happening. And so that started to get me thinking more and more about it. At the same time, I was involved in what's called a clinical care extender program at a hospital, and I was watching what was going on inside the hospitals, and I saw just some of the practices that were involved inside of a lot of hospitals, where they weren't spending much time with their patients. It was I was spent a lot of time in the ER. I was smelling some of the smells. I was not liking the blood, and it didn't feel like a place of healing to me. Whereas when I was looking at this chiropractic office, it felt like a place of healing, a place of health, and that's where I started learning more about it. Along with that, I was also in that time one of my I saw a chiropractic student at the time when I was dealing with some neck pain from childhood, and I never knew what it was, but he ended up just started, I started working with this chiropractic student doctor, and after just, maybe 5 adjustments or so, my neck pain was so much dramatically improved, and all these things started adding up, and so I really felt like life was calling me to really pursue this calling as a chiropractor, and so I went into chiropractic school, and it's been just an amazing ride, and the miracles and the joy I get to see on the patients' faces every single day when I come to work is just it gets me excited to wake up in the morning, and I just love what I do. Now, I want to circle back because there's a couple things that if it wasn't for chiropractic, I wouldn't be alive. Let me tell you the story. So my chiropractic, as far as I know, started with my grandma. Okay, so my grandma, she actually ended up having a miscarriage when she was younger, or like maybe really really young, in their teens, I think like 18 or something like that, and she, you know, soon after that ended up kind of experiencing a lot of, I guess you'd say that she was having mental problems, and they were actually going to put her in an insane asylum, and she was, for some reason, somebody else that she knew was at a chiropractor's office. She was with her, and the chiropractor went up to her and said, "Hey, look what's going on," and actually found what's called a subluxation. Learned a lot more about that in her neck, a misalignment in one of the vertebrae in her neck, and started adjusting her after an exam and things like that, and that, I guess you can call it craziness, actually went away. So she was actually able to not have to go into an insane asylum, and that's, obviously, later on she ended up telling, because when I was a kid, I was just a baby, and this is the other part of the story. I was a baby, and my legs were bow-legged growing up, and my mom had me in these casts, and I didn't know anything about this at the time. I was a baby, and I was miserable in them. I hated them, and my grandma ended up telling my mom to take me to a chiropractor. So the reason that I'm able to walk straight now is because of a pediatric chiropractor that was able to help me out. So really, chiropractic has been part of my life even before I knew it was part of my life. And it's really made a huge difference for me, and I just am excited to share it with you. And that's my story. So talk to you soon.